Welcome viewers to SLG Hello Doctor. We are meeting for the first time in 2021, so once again a very happy new year from team SLG Hello Doctor and SLG Hospitals Hyderabad. In this episode, we'll be learning about coronary heart disease and associated surgeries from our expert guest, Dr. Vivek Babu, Consultant Cardiothoracic Surgeon at SLG Hospitals Hyderabad. Thank you, Dr. Vivek, for joining us here on SLG Hello Doctor.
Thank you.
We are looking forward to our conversation with you, which will take us through bypass surgery and all the implications it has for people like us. Doctor, can you set the context for us and tell us what is coronary heart disease?
One of the most common diseases for adults is coronary artery disease. So what happens in this disease is cholesterol tends to deposit within the arteries which supply the heart. So because of that, people tend to develop chest pain, heart attacks, and even sudden deaths. So coronary artery disease is common once you reach age of around 50 to 55 years. In certain risk factors are there for this coronary artery disease. If you have diabetes, if you have hypertension or high BP, if you have a family history of heart disease, or if you're a smoker, so they tend to develop much faster and more serious disease. So what happens is, if you see the heart, there are three arteries which supply the blood vessels to the heart. So if when you have a block which is more than 70% of the artery lumen, then you start getting symptoms. You start getting chest pains. Sometimes you can get sudden heart attacks and end up in can have to go to emergencies also. Sometimes when the block is very tight and in one of the major arteries, you can even die of the disease before reaching the hospital also.
Doctor, so what are the treatment options available for coronary heart disease? And most of us have heard of bypass surgery. Is that part of this plan?
So when you have a coronary artery disease, we do certain tests. We do an echocardiography to see whether the heart function is good. We do an ECG to see whether you actually have coronary artery disease. If you have milder symptoms, then we tend to do a test called treadmill test, where we make you walk on a treadmill and check the ECG. In such a case, if during stress, if you get those symptoms, if you get the chest pain, that will be evident on the ECG machine. Once you are sure that you are suspected of having coronary artery disease, we do an angiogram. So angiogram will let us know how severe is the coronary artery disease. In milder forms, wherein the block is only 40% or 50%, most of these can be treated with medicines. You can take precautions to reduce your heart disease. You take blood thinning tablets to ensure that blood flow is proper. You take cholesterol medications to make sure that it doesn't progress. But once it progresses beyond the 40-50%, once it goes to 70-80 or even 90%, then the treatment options change. You either have stenting or angioplasty or bypass surgery. And there are various differential indications for both these things. When you have more serious disease, when all the three blood vessels are involved which supply the heart have a significant disease, then bypass is one of the options. Bypass surgery is also indicated if you have diabetes and significant triple vessel disease, what we call, or if you have a heart failure, that is heart function is down, and you have a significant artery disease, then also bypass surgery is indicated.
We've been hearing a lot nowadays about beating heart bypass surgery. Can you elaborate a little bit on that, sir?
Yeah. Since the beginning of cardiac surgery, we have been doing surgery the conventional way, wherein we use a machine called as heart-lung machine. This heart-lung machine takes the work of the heart and the lungs, and then we stop the heart and do heart surgery, do bypass surgery. For the last decade or so, we've been doing it on what is called as beating heart. That means during the surgery, the heart is still beating. You're not stopping the heart during the surgery. We have specialized instruments now called octopus stabilizers, wherein we stabilize that part of the heart where we are doing the surgery, and the rest of the heart continues to beat. So there are a lot of advantages of doing this on beating heart surgery. One is there is reduced bleeding, because we tend to use less blood thinning agents. There is reduced bleeding. And also in conventional surgery, anesthesia, the post-operative recovery rates often slower. Patients used to stay for 8 to 10 days in the hospital. Whereas in beating heart surgery, we can often discharge them within 4 to 5 days. There are also certain other advantages, like there is less incidence of kidney damage or brain damage. It's also very good in elderly people who cannot tolerate this conventional surgery where you have to put them on heart-lung machine. So it's got a lot of advantages. Here at SLG, we nearly do 100% of our cases, 19% if you can give it a more solid number, where we do beating heart surgery. So there are some indications where we have to do on pump surgery or the conventional surgery, but most of the times we do beating heart surgery.
Doctor, let's say I have both diabetes and hypertension. Am I a good candidate for bypass surgery?
That's an excellent question. Actually, when we do bypass surgery, we have nearly 70 to 80% patients have either diabetes or hypertension, and combined diabetes and hypertension is seen in nearly 40 to 50% of cases. So we're used to dealing with patients who have diabetes and hypertension. In fact, the need for bypass surgery is more in patients who have diabetes and hypertension. Whereas if you don't have diabetes and hypertension, you are less likely to have severe disease and more likely to, so then medicines or even stenting is feasible in your case. But once you have diabetes or hypertension and significant heart disease, then the option is only bypass surgery. So bypass surgery is very much indicated in patients who have diabetes and hypertension.
Is there any age limit after which they can't go through the surgery? Like let's say somebody is 70 years old or above. Is it okay? Is it feasible for them to go through the surgery, recover and actually recover well and go about their jobs?
See, as I mentioned earlier, the coronary artery disease tends to develop only in elderly people. It is not a disease of the young. So we hardly see any patients less than 50 years, or the percentage of people coming for surgery with less than 50 years is very low. So most of our patients are 60 plus. And now there is so much advancement in ICU care, in surgical care, in our instrumentation, in availability of blood products, in the nursing team, in the anesthesia team, that we are doing surgery even in patients in 80s. Actually, what we see is mostly patients in 70s, 75, 80 and all come for surgery. We have done operations, bypass surgery in patients who are 85 years of age, emergency surgery in people who are 80 plus also. So 70 is no longer, especially with the way India is advancing right now, and our life expectation is improving. 70 is no longer a contraindication to do bypass surgery. In fact, 70 is the most common age we do bypass surgery.
Thank you for that clarity, doctor. Now, how long should a patient stay in the hospital after surgery?
So it's heart surgery. Bypass surgery is a major surgery. So generally we have to plan it in advance. So what we do is generally when a patient is ready for bypass surgery, we usually admit the day before the surgery. We do various blood tests. We check almost every system, every organ we check to make sure that they have a very smooth surgery. So we check the blood vessels to the brain to make sure they don't have any issues with the blood supply to the brain. We check lung function, we check the heart function, we check kidney function, we check liver function. We do blood tests to make sure that their hemoglobin levels are all right, whether they have any bleeding problems and all. So generally, we want them to be admitted one day prior to the surgery. The anesthetist will also come and see, the intensivist will also come and see to make sure they have a smoother course in the hospital. Once the surgery is over, usually they have to stay in the ICU for a couple of days and then another 2 to 3 days in the ward. So usually it takes around 4 to 5 days for them to fully recover and go home. After that, we ask them to take it slowly. Once we discharge them home, we ask them to take it slowly and not exert themselves too much. So usual walking around the house, not go outside because the wounds are still fresh. So then, and then we call them back after a week to assess how they are, to check the BP, to check the heart rate, clean the wound, remove any stitches which are there. So usually it takes around 2 weeks for them to fully recover from the surgery. Once the 2 weeks period is over, generally we allow them to go outside, talk to friends and all. But to return back to work depends on the kind of work they were doing. So if they are in an office kind of work, if they're office environment, usually we ask them to take rest for around 3 to 4 weeks. But if they're into manual labor, if they have to do, generally we ask them either to change over to a less strenuous job or ask them to wait at least for 3 to 4 months. So what happens is when you do an incision, the surgical recovery is quite fast, but we cut the bone and do surgery. So the bone healing process takes time. So we don't want them to exert themselves. We don't want them to, there are certain precautions you have to take. You cannot just bend down and pick up things. You cannot lift heavy things, because when you do that, you are putting a strain on your chest and then that can cause you pain. We don't want them to lift their grandchildren. And then if they have any kick on that area, they can have severe pain, they can have bleeding. So generally we ask them to take it slowly, because at the end of the day, it's a major surgery. It's a 4 to 5 hour major surgery. So they have successfully recovered from the surgery. So they have to take it a little bit slowly and then slowly recover. Usually after a month, we see that they're generally returned back to nearly normal stage. Some elderly people may take a little bit longer, but usually most of the younger, by elderly I mean 75 plus. I don't mean 50s or 40s. Elderly in our parlance is usually anyone above 75 and all. So someone who is 60, 65 usually can recover easily in 3 weeks or so.
Let's take a short break now.
Presenting SLG Hospitals, the next level medical destination. Envisioned by Sri Dandu Shivaramaraju and family. Powered by cutting-edge technology and compassionate care, this 999-bed tertiary care facility adopts the latest medical practices followed worldwide. Built as per JCI guidelines and NABH quality standards, SLG Hospitals offers a wide range of solutions for all simple to complex conditions in all specialties of medicine. SLG has been able to attract the best of medical talent due to its vision, sheer scale and scope. With matchless experience and expertise, they are SLG Hospital's biggest strength. The team is ably supported by advanced technologies, infrastructure and protocols to deliver finest outcomes for patients. SLG Hospitals, the next level of care.
Welcome back to SLG Hello Doctor, and let's take the conversation forward. Doctor, an athlete friend of mine, she's around 38 years old, and she had a heart surgery. And she has reported that she was able to start running again within 2-3 weeks, and within 4 weeks or something, she was running about 3 miles a day. So is that possible? Is that even advisable for her to do?
Absolutely. There are different types of surgeries. So what your friend has undergone is, I think she has got a hole in the heart from birth. That's why the age at which she underwent is only 37, 38. Whereas a conventional bypass surgery patient is a bit older. But it all depends on your mindset. So we have had patients, we have had doctors, I have operated on doctors who are ready to join back duty after 2 weeks only. They're saying, I'm perfectly fit, let me come back to work. So a lot of it depends on your activity level, your mindset before you undergo surgery. I've seen, I used my gym, and there is a gentleman around 70 plus, used to come regularly and do a treadmill for nearly 1 hour. We younger people used to be embarrassed by the amount of energy he used to put in this. And he had bypass surgery and all. So it all depends on our mindset. There are certain things which we don't allow because of the stress, because if they strain the chest area, then they can have fractures of the bone there. So generally we don't ask them to do some heavy lifting, weightlifting exercise. But if it's a conventional treadmill, jogging or going to treadmill or doing yoga, it's perfectly acceptable. In fact, driving cars. You can drive cars after 3 weeks or so. You just need around 3 to 3 weeks of rest. Initial few times you better take someone with you because you're not sure, because you're restarting. You take someone, either your spouse or a friend with you, so that you're not inconvenienced by the drive. But after that, you go back to leading your whole life. The whole idea of doing the surgeries, get back to your old life, what you are leading. And most of the times they often get better after the surgery, because the chest pain disappears, the breathing difficulty disappears, so they'll be more active, there'll be a lot of enthusiasm, suddenly they get that energy to go ahead and do something fresh, Mindset is the basic factor in this. So suppose you're depressed, you keep thinking, oh, what I've undergone, I'm a burden to my children, then it'll take much longer for you to recover. But if you feel that, no, this is my life, let me live my life, absolutely, you can go ahead and do it.
Yeah, I think so. It's important to have a positive attitude.
Absolutely. Yeah.
Keep your chin up. Actually, we were more worried for her than she was herself.
And you know what, I always tell the patients, you are the best judge of how capable you are. So if you think that you are capable of going for a 1 hour walk or 1 hour jog, then you are the best judge. I cannot judge how fit you are. I mean, I can only guide you. I can only say, okay, you can go ahead and do this exercise. But whether you are capable of running a marathon and all, it depends on you.
So after the surgery, doctor, is the patient supposed to be on any kind of medication, and for how long?
So essentially, the coronary artery disease is a lifestyle disease. It's a disease we are born with. In fact, if you take a section of population above a certain age, nearly everyone gets this coronary artery disease. So it's a disease of essentially aging. So there are chances that after you undergo stenting or after you undergo bypass surgery, that you can still develop, because your lifestyle have not changed. You still eat cholesterol, you still eat oily foods, you still have the stress of life. So you need to take medications to make sure that you don't progress to further complication, further disease. So generally we tend to give them blood thinning tablets. The blood thinning tablets, what they do is they make sure that the blood in the heart flows very smoothly. Generally, most of the times the reason they get this blocks is because the blood clots inside the heart, inside the blood vessels. So by giving blood thinning tablets, we prevent this blood clotting. The other thing we are worried about is cholesterol levels. So we generally tend to give anti-cholesterol tablets called statins. There are various brands, various types of statins. So we tend to be much more stricter in cholesterol control when we do heart surgery. So one of the parameters we check is a lipid profile, or we check the LDL cholesterol level. The LDL cholesterol level in all of us needs to be around less than 100. But when you have bypass surgery, angioplasty, it needs to be much further down. It needs to be less than 70. So we are much more stricter in controlling cholesterol, because we don't want them to have this disease again. If suppose someone has that surgery at 60, 65, he's got a long life ahead of him. We want them to live that long life. So we want them to have a stricter control on cholesterol, take blood thinning tablets. We also give certain tablets called beta blockers, wherein we reduce the heart rate, we reduce the heart energy consumption. We don't want them consuming so much of energy. We don't want them having this stress. When you get angry, your heart rate tends to go up. We don't want that. We want them to have a lower heart rate, so that the heart energy requirement, the oxygen requirement is low, so that we don't get this disease back again. So there are a lot of medications, and they have to be on these medications pretty much lifelong.
Doctor, you specifically mentioned about cholesterol, and that's a question uppermost in everybody's minds. I know that, including mine. So what is good cholesterol, what is bad cholesterol, and how does any of them affect the heart, whether positively or negatively, whichever?
So actually, in this modern era, our dietary habits have totally changed. We don't eat what our grandparents were eating. So we tend to eat a lot of junk food, we tend to eat a lot of oily food, and we tend to eat quick food, fast food. So because of that, there are, and the latest research has shown that cholesterol affects negatively the heart function. So when you do fasting lipid profile, what you call cholesterol testing, there are two types of cholesterol which are important. One is called LDL cholesterol, low density lipoprotein cholesterols. They are the ones which actually deposit in the arteries, in the blood vessels. So that cholesterol is very important. That should not be very high. If you are a normal person, you generally tend to maintain it below 120, 130. Actual figures are 140, but you want to maintain it around 100. So 100 plus or minus. So that cholesterol tends to deposit in the arteries. If the cholesterol is very high, if the cholesterol is 170, 180, then you have to make efforts to reduce that cholesterol levels. There is another type of cholesterol called HDL cholesterol, or good cholesterol. That cholesterol tends to take away the cholesterol, that the protein tends to take away the cholesterol from the blood vessels and get it to the liver. So that's a good cholesterol. That's called HDL cholesterol. That should be on the higher side. Unfortunately for us Indians, we have our LDL cholesterol can vary based on our dietary habits, but our HDL cholesterol is often on the lower side compared to Western population, and there is no way to increase. There are certain medications, but they have not been found to be efficacious even if you increase the HDL cholesterol. Genetically, you should have good HDL cholesterol.
Our diet does not supplement that.
The diet affects the LDL cholesterol levels. So what you have to do is, there are certain things. Our food is either sweet rich if you take ghee sweets, all our sweets, if you consider, are oily and they contain sugar, they contain oil. If you take any of this peda or mithai and all, contains ghee and sugar. Both are deleterious to the heart. So there are certain things we should avoid. We should avoid too much of eating oily foods. Then the concept of eating these fast foods, that also is not good, because fast food tends to make them delicious. They tend to put more oil. So you should eat less fatty food. Then there are certain nuts which help you in reducing the level of this LDL cholesterol, increasing the HDL cholesterol. Any nuts, walnuts, almonds, chia seeds. These are the good things. So if you take them for breakfast, say few almonds every day, that is good for the heart. Similarly, fish, if you are a non-vegetarian, fish is a much better food than the red meat, mutton. Even if you take chicken, the skinless chicken is much better. Fish is actually a very good food for the heart, because fish has got lot of antioxidant vitamins which tend to prevent all this developing this heart diseases and all. Similarly, any oil is bad. You can say among the oils, if you see, olive oil and sunflower oil, safflower oils are slightly better, but any oil is bad. If you take oil, if you think that I'm doing a good thing and taking a lot of sunflower oil, it's still bad for you. Any oil is bad. So in moderation, taking oils in moderation, taking fatty foods in moderation, all helps. The other important thing which we are seeing a lot of it is smoking. Smoking is an absolute no-no, because smoking tends to injure the blood vessels, and we have seen patients as young as 28, 30 come with a heart attack just because smoking. So smoking, then the other thing which is slowly coming up now is the sugar intake. And diabetes is a killer. Diabetes is a killer disease. It tends to affect kidneys, it tends to affect heart, it tends to affect eyes, your legs, everything. So people who have diabetes tend to have more significant heart disease. So you have to control your diabetes, go for exercise. The other thing is exercise. Regular exercise is always good. It tends to perk up your heart. Because when you do more exercises, you are increasing the good hormones and trying to reduce your LDL cholesterol levels also. So exercise is good. Good dietary habits, no smoking, try to control your diabetes and hypertension. These are all the factors which help you in preventing development of this significant heart disease.
Easier said than done, because India is the diabetes capital of the world. So
absolutely, and I can totally concur with that, because it is very difficult to. I can preach, but then it depends on us how we go ahead and do it. So yes.
Thank you so much, Doctor, for sharing all those nuggets of information about cardiac surgery and how to take care of ourselves before and after.
Thank you. It was a pleasure talking to you. Thank you.
Thank you, viewers, for joining us here at SLG Hello Doctor. We'll be back with you in another 2 weeks with yet another wonderful episode of health information. Until then, stay safe, stay healthy, look after yourself. Namaste. Do subscribe to our YouTube channel SLG Hello Doctor to catch our fortnightly capsules of knowledge sharing. Don't hesitate to fill our chat box with any questions or queries you may have for our panel of super specialists and get the best advice from them.